Thank you, Chair, and thank you to our guests this morning. Mr. Reid, could I just ask you a pair of questions, if you please, and just join them up, maybe, if you could respond to them. Just in terms of serial testing that you've outlined in healthcare, I brought this up at committee before, but are there any plans to consider doing either random testing or temperature testing of hospital care workers? I think, as I said before, these protocols are in place in factories. I'm not sure why they can't be implemented, at least randomly, within the HSE. And the second thing is in relation to congregated settings, particularly to do with the meat industry. And we heard from the last couple of forums that we had here in terms of the meat industry, the issue of foreign workers, I suppose, being domiciled together, all of that. The HSA said it was not their remit, that it was a public health remit, and I'm wondering, has the HSE any intention of looking at that or engaging with the meat industry to try and see how that might be ameliorated in the future?
Thanks, Deputy. I'll take the first question first. The serial testing that's completed obviously was targeted, focused in the nursing homes in particular for healthcare workers. Obviously, in some stages, at some cases, we also would have tested some of the residents as well. Just particularly in relation to your second question on the meat plants, there is a National Standing Oversight Committee which has been established. I referenced it just briefly in my opening comments, and the purpose of that is it has multi-agency representation on it, looking at the various aspects that have arisen from our assessments of meat plants. So you have a whole range of state agencies, and I won't go through them just here, but they have looked and assessed a wide range of issues that emerged, and they are issues that have emerged in terms of organisation of the plant and social distancing, spacing, and how that can be operated. And I should say the industry has engaged quite well with us, very responsibly. Issues around transport to work, whether it's shared transport, issues around home settings and shared accommodation, so sometimes shared accommodation, shared transport, and in some cases to multiple different plants, so some issues around that. So it's a range of issues that the National Standing Oversight Committee are looking at, and they are also specifically, one of their terms of reference is to look at the legislation and the base of legislation for the various agencies in terms of enforcement. And that's progressing now quite well.
Okay, thank you. You might come back to me. Actually, my question in the first instance was in community hospitals, not in the residential care settings. But maybe, I know it's been covered before, but maybe the thinking has changed. Can we look at random testing of healthcare workers in community hospitals? Just in respect then of diagnostic tests, we had the DAA in here some weeks ago, and the Department of Transport. And Department of Transport were suggesting looking at a protocol where people would get COVID testing done before they flew into Ireland, and the suggestion was that there was testing available outside of Ireland, diagnostic testing that could be done within a matter of days or less. Are you aware of those tests? And also, could you update the committee on any other diagnostic tests that you're looking at outside of the PCR test? I know you mentioned the saliva test. Are there any others there as well, please?
Ask Dr. Colin Henry, please.
Deputy, is in broad terms the three modes of testing, all of which are determined by expert advisory group and input, and HICWA have input into this by doing their own assessments. So there's the current PCR test, which is determined to be the most sensitive and real time of the three broad categories. There's antigen testing, which doesn't hold as much promise at the moment, and there's antibody testing, which, as more evidence emerges, as we know now, is more useful in determining population exposure or particular risk groups exposure, but not current level of infection. So working off PCR testing, then the mode of testing is currently nasopharyngeal swab, which of the different types of swabbing available, it presents the most sensitive measure. And as was alluded to earlier by one of your colleagues, we are looking at the more the easier for children certainly version of this, which will be salivary testing, but that is to be determined by the EAG. On NEFIT, the expert advisory group is always considering new and emerging evidence from other healthcare systems on modes of testing, not in those three broad categories, and the mode of actually carrying out the test. At this point in time, in August 2020, it's nasopharyngeal swabbing is by PCR by nasopharyngeal swabbing is our preferred mode of testing, as it is throughout most healthcare systems in the West. So, but we are constantly monitoring new evidence and new proposals that are coming to us, and new evidence from other.
Sorry, Chair, could I just ask 3 questions just to be answered in writing, if you please?
Yeah,
very
as
quickly,
long as it's answered in writing.
Yeah, just one in relation, maybe for Mr. Reid, the use of plasma and ultraviolet systems for infection control. Are you encouraging those uses in hospital, please? Secondly, in terms of the proposed service agreements that you might reach with the private hospitals, I'm aware of patients who have been waiting on diagnostic tests in public hospitals, who have been sent out to the private hospitals, have not been COVID tested and have been sent back awaiting a COVID test. Can you get a protocol in place for that situation, please? And the third thing is in relation to masks at national schools. You've probably seen in some of the states in America now, they're now talking about putting masks on kids at national school. Are we looking at any of the evidence that they are looking at, please? You can come back in writing. Thanks.
Thanks very much. Thank you. I'd like to move on to the next speaker, and I would appreciate if you could provide an answer in writing to Deputy Shanahan. The next